Well, in the health system in the UK, we have done some quite dramatic things, and we've learned a lot of lessons, and some of them are mistakes we've made, which clearly we should share, but some of them we've had some quite big successes. I think one of the things we've learned that's really important is that this is not just a health care issue, that it's a health issue. It's core to how we do our business, and we have to look at what health systems are there to do. Are they there to just treat illnesses when they arise, or are they there genuinely to improve health and protect health? Now, that's fine to say, but if you're a member of staff and we're busy, as clinicians or as managers, we're running around chasing our tails, so we haven't got time to switch the lights off or on. It's very, very busy out there. But actually, the one message I would have is that most of us who work in the health service in any country feel passionately about the service we're giving to other people. So we're a very good workforce to potentially understand what it makes to make health future-proof, to do more good than harm. Unfortunately, when we come to work, all the fine principles and actions we have at home often go out of the window when we come to work. Literally, sometimes we just open the window to let the heat out instead of turning the heat down because we don't know how to turn the heating off. We're very disempowered as health workers when we're at home, when we're at work. What I want people to do is to feel much more able to say to their bosses, say to their chief execs, say to their colleagues, why don't we do this? We should be able, I can recycle easily at home, but I can't recycle at work. I can control the heating at home, but I can't control it at work. I can make suggestions at home for how we have a much more sustainable system at home, but I can't do it at work. What is it that stops us doing these things at work? Now, it would be great if the leaders, if our bosses, were open to really good ideas. Most of the great ideas that we've implemented in the UK, in England, have come from staff. They haven't come from people like me. I don't think I've had a great idea in my life. They've often come from staff to say, look, we've got lots of land out there. Why don't we let the patients walk around while they're recovering? Why don't we have the staff have allotments out there? Why don't we put beehives there? Why do we treat all our outpatients in this hospital? Why don't we take the clinic much closer to work, to their people's homes? We often see hospitals as the locus of care, the centre of care, when we should actually much more help people take much more control of their own health themselves.
Think of the impact you can have on the environment through your work. If you see something that's being wasted, report it. Give our office a ring, tell us about it. Don't just take things as they are. Don't if you're working as a nurse in a ward and the ward is too warm, don't open the window. Look for the rads to be turned down. It's those type of small things that can make huge, huge changes.
We have many hospitals in Europe, so we have 15,000 hospitals, and you can find good examples wherever you look. But what we think is you need to have the policies in place and the commitment from new leadership, and you have to have the bottom-up approach. You have to have an engaged staff that are aware that you can actually influence and shaping the workplace. It's empowering and it's actually leading to a better work experience. And one example I'd like to share with you is the Energy Saving Hospital project that has been running for 10 years in Germany. And there, the hospitals are saving between 500,000 and 1 million per year with the energy savings. And they have to reach a high goal because they have to cut their energy consumption by 25% over 5 years. They have to have an energy management plan in place, and they have to have an external audit. But having that project has actually sparked competition among hospitals close to each other, and there is a networking event happening every year, and people really getting together and learning, and that's the kind of work we encourage.